Quick question for you. When was the last time you went to go see a urologist? For most guys, the answer is going to be somewhere between never to what even is a urologist. And that's a problem because by the time most guys finally walk into my office, they've usually been dealing with their problems for months and sometimes even years. They're at home suffering, looking up things online on ChatGPT, hoping they can find an answer or hoping that the problem will just go away on its own. Today, I want to fix that. I'm going to walk you through the 5 most common reasons people end up in my office. Just kidding. Although it is a big one, even for young men. So let's go through the 5 most common reasons people come to see a urologist. If any of this sounds like you or sounds like someone in your life, you will know exactly what's going on and what to do about it. So let's get into it. Number 1, kidney stones. If you've ever had a kidney stone, you know. If you haven't, just know this. Guys who have had them often say it's the worst pain in their life. And women who have had both kidney stones and childbirth sometimes say the kidney stone was even worse. Believe it or not, I have had a kidney stone myself, and I will never forget that day. I literally collapsed on the floor of the gym that I go to in excruciating pain, thinking I was dying. And it turned out to be a kidney stone. So what exactly is a kidney stone? It's basically a hard little crystal that forms inside your kidney from minerals and salts in your urine. Most stones are small enough that you can pass them on your own. Some are too big and need a procedure. So what are the classic symptoms of kidney stones? Well, they could include severe pain in your side or your back that comes in waves, blood in your urine, nausea, vomiting, and sometimes even a fever if there's an infection. So why do we get kidney stones in the first place? Well, there's a few reasons. Dehydration is a huge factor. If you're not drinking enough water, your urine gets concentrated and it's easier for crystals to form. Genetics also plays a big role too. And certain medical conditions like gout or hyperparathyroidism can increase your risk of stones. And listen, once you've had a stone, you're at higher risk of getting another one. Now let's talk about diet for a minute, because this is the one I feel people get wrong a lot. First, you gotta be careful with salt. And I'm not talking about salt that you add when you're at a restaurant on top of your food. I'm talking about the hidden salt. Fast food, chips, sauces, restaurant foods, that Taco Bell veggie Mexican pizza that I love eating, 750 milligrams of sodium in one serving. And what about that Gatorade that you're chugging for hydration? 270 milligrams of sodium per bottle. Plus, on top of that, 34 grams of sugar. But what about as your daily drink? Well, you're not really hydrating. You're just adding salt and sugar to your urine, which is the perfect recipe to make stones. Then there's animal protein. If you're eating a lot of red meat, chicken, fish, eggs, it can make your urine more acidic and lower your citrate levels. And citrate is the thing that helps prevent stones. Sugar is also a stone maker. Soda especially. Between the fructose and the phosphoric acid, it's basically a kidney stone in a can. And then there's oxalate-rich foods, spinach, almonds, beets, rhubarb, dark chocolate, even some teas. But when you eat too much of them, it's gonna cause problems. Oxalate, which is found in these foods, is the stuff that binds into calcium to actually form the stones. These foods are healthy, so I'm not saying cut them out completely, but if you're a stone former, don't overdo them. The good news is we have a lot of ways to handle kidney stones. Small stones often pass on their own, either with just time, pumping up your fluid intake, and maybe a little help from pain medications or medicines to relax your muscles. Bigger ones, unfortunately, often require some kind of procedure. Lots of procedures, hopefully you never need one. So here's my honest advice on stones. The best approach I feel, and this is what I tell my patients every single day, is prevention. Drink water, lots of it. Watch your salt intake, watch your animal protein intake. And if you keep getting stones, we can actually analyze a stone to figure out exactly why you're making them. And once we know why this is happening, we can try to tailor treatments or preventative measures with either supplements or medications, or, as I've already said 17 times, getting you to drink more water. Number 2, you can't pee. This is one of those things that doesn't honestly get talked about much, but when it happens, it's absolutely terrifying. I know because it's happened to me. The day after I had my kidney stone surgery, I suddenly couldn't pee. Guess what? I was constipated from all the pain meds I had been taking during my surgery. So once the number 2 happened, the number 1 started flowing just fine. Now, my case is a little bit unusual, but for most guys, the cause may be different, and it doesn't hit all at once. It could be something that builds over years. The most common reason in guys over 50 where they can't pee, where their flow is blocked, is actually enlarged prostate. Studies show that after the age of 70, about 1 in 10 guys will have a sudden episode where they just can't pee. By their 80s, that number is closer to 1 in 3. But honestly, it's not just about being older and the prostate. It could be things like constipation, like what happened to me. It could be things like medications that you've recently started. It could be a kidney stone trying to pass, or big blood clots blocking your flow. It could even be like a urinary tract infection. For some people, it could be a nerve issue, diabetes, MS, spinal cord injury. Remember, your bladder is a muscle and it needs nerves to work. If you're having a hard time peeing, having a weak stream, you're getting up multiple times at night, or straining to go, don't ignore it. Catching this early can save you from a lot of trouble down the line. And listen, guys, if you literally cannot pee and your bladder feels painfully full, that's an emergency. Go to the ER. You may need a catheter that's put inside your bladder to drain it. And doing this is actually going to protect your kidneys. And of course, it's going to make you feel better. So don't just sit at home hoping it's all going to pass on its own. Number 3, low testosterone, or low T. This one is everywhere right now. You can't go on social media without seeing these influencers hype up testosterone and trying to sell it to you like it's like some miracle drug. It's like as if it's like some super soldier serum that you would see like Captain America take. But listen, testosterone is a real thing, and low T is also a real thing. But to be honest, I personally think it may a little bit be overdiagnosed and maybe even overtreated. So here's the situation. There's actually a checklist we use called the ADAM questionnaire. It asks stuff like, do you have low energy, low sex drive, low strength? Are you sad, grumpy? Are you falling asleep after dinner? But here's the problem. Read that list back to yourself. Who hasn't felt that way, ever? Like, I know me, after a stressful week at work, a couple of bad nights of sleep, or simply, feeling like I'm getting older, these symptoms are basically describing every guy who's over the age of 30 and 40, who has kids, who has a job, who has stress. So, a lot of guys feel like they have low T, they go online, find this questionnaire, and they're 100% convinced, hey doc, I think I have low testosterone. So what do? We check their levels. And guess what? In most cases, they have normal testosterone levels. So here's what I tell patients before we jump into testosterone replacement therapy. I tell them, let's check the basics. How's your sleep? How's your exercise? How's your stress levels? How's your weight? And then we get into the medical stuff. Do you have sleep apnea? Do you have thyroid issues? Do you have vitamin deficiencies? Are you on medications? A lot of guys that fix the lifestyle stuff actually start feeling better naturally. And when they start fixing their lifestyle, even if they have normal testosterone levels to begin with, they're actually gonna notice a normal increase in levels as well. Now, let's say you've done all this stuff and your levels are genuinely low. And that, according to some, means a number in a lab test that's under 300, tested twice, first thing in the morning. Then, if you have the appropriate labs and you also have symptoms, then testosterone replacement therapy may be a good option for you. But please don't fall into the testosterone trap. Get checked properly first before you go ahead and give money to some guy off Instagram, or get testosterone from someone at the gym, or sign up through some online pharmacies. When it comes to testosterone, it's a real thing, and replacement therapy has lots of positive benefits, but it's not for everyone. And if it is for you, get it through the right hands. Number 4, vasectomies. This one's a little different from the others. This isn't like a disease or a problem. It's actually one of the most common guys come to see me as a urologist. Over 500,000 men in America get a vasectomy every single year. And that number every single year is actually climbing. A vasectomy is a permanent form of birth control for men. And here's how a vasectomy works. You come into the office, or sometimes these can be done at a surgery center. You lay down, we numb the area, which in this case is your ball sack, we make a small little opening in your scrotum, usually so small that you can't even see where the opening was made. And what we do then is we find a little tube. This tube is called the vas deferens. This is the tube where the sperm travels through. Once we find that tube, we cut it, we divide it, we seal it, put it in different sections within the space, and then we move on to the other side. So we do this on both sides because you naturally have two vas deferens. The whole procedure, whether it's done in the office with you awake under local anesthesia or done with you having some form of sedation in a surgery center, takes about 10 or maybe 20 minutes to do. That's it. It's pretty quick. So after the procedure, you go home, you take it easy for a couple days. Most guys within a few days are pretty much back to their normal routine. So now let's talk about the myths. Let's knock these down right now. A vasectomy does not change how ejaculation or orgasm feels. Most couples that I see in the office after a vasectomy actually tell me like they're actually having better sex. They're having actually way more fun because they don't have to worry about having another kid, diapers, strollers, or pregnancy. One thing you do need to know, however, is you are not sterile right away. You actually still have swimmers beyond where we've cut that need to be emptied out. So the general recommendation is you need to ejaculate. You need to empty your pipes at least 20 or 30 times to clear that sperm out. And even then, you can't just assume they're all cleared out. We would want you to do a semen analysis, which is where we check your ejaculate for semen. And this can be done at home through these home tests, or it can be done in a lab. Once the specimen has been evaluated under a microscope and there's no sperm, then bro, you're shooting blanks. And that's when you get the green light. You now have an effective form of birth control. The big thing to remember, again, is that vasectomies are permanent. And yes, I do reversals. We can reverse it if it's needed. I do them myself, but they're very expensive. And importantly, they're not always successful. So you should never go into a vasectomy thinking, hey, I'm gonna get this now and I can always reverse it later. Go in 100% sure that you and your partner are done having kids. Last, but certainly not least, by far the most common reason guys come to see me, erectile dysfunction, or more commonly known as ED. Yeah, remember that Family Feud bit at the start? Turns out I wasn't totally joking. Let me say something right up front. If you're dealing with erectile dysfunction, you're not alone. And it does not mean you're broken in any way or you're less of a man. ED is actually incredibly common, and it gets more and more common as we get older. And I'm actually seeing more and more guys at a younger age, they're in their 20s and 30s, that are coming to see me with erectile dysfunction. So unlike what many guys think, like, hey man, losing the ability to have an erection is an old guy problem, it's an any guy problem. So what causes erectile dysfunction? There's a few things. And honestly, this is where most guys get it wrong. They immediately think that they're having erection issues because their testosterone is low. And sometimes that may be the case, but way more often than not, that's usually not the case. It's usually not a hormone issue. It could be your blood vessels. Erections are basically a plumbing situation where you need really good blood flow into your penis. So anything that damages those blood vessels, whether it's high blood pressure, diabetes, smoking, high cholesterol, can really mess with your erections. And in fact, this is the most important warning sign sometimes for heart disease. Sometimes years before guys even have heart attacks, the first warning sign is usually erectile dysfunction. So when I see a young guy, whether they're in their 30s or 40s or like just 50s, I always ask them about heart problems, family history of heart problems, and if there's any kind of concern, we will actually expand the team and have them go see a heart doctor. Because if erectile dysfunction is the only thing this young, healthy man has, we need to take a deeper dive into their heart. So beyond the heart, what else could it be? Well, it could be stress, it could be mental health issues, it could be anxiety, depression, performance pressures. About 20% of guys with anxiety and up to 40% of guys with depression report some kind of sexual dysfunction. It could also be your lifestyle. It could be lack of sleep. It could be no exercise. It could be that you're overweight. It could be drinking too much alcohol, smoking, whether it's cigarettes, vaping, marijuana. All these lifetime decisions you make, they add up. On top of that, it could also be the medications that you're on. It could be blood pressure medications. It could be antidepressants. It could be so many other factors in the medications that you're taking that could also be causing issues with your erections. So here's the good news. As urologists, we have a lot of options to treat erectile dysfunction. So if you're dealing with this at home and you're online on Google or typing away at ChatGPT looking for answers, you don't have to kind of search that deep dark web or use some AI generated response to help you. Come on and see us. We can help. So these are the top 5 reasons people come and see a urologist. And there's a lot more reasons people come and see us, and we'll save that for another day and another video. But if you've noticed something, almost all of this stuff is treatable, and a lot of it is preventable. And the guys who do come in early can be treated. And the things that are bothering them, keeping them up at night, we can help. But there's also one important thing I want to notate. This is kind of like my little disclaimer. I'm a urologist and I love what I do, but I don't have to be your first stop. Your primary care doctor. A lot of what I actually treat can start with your primary care doctor. They can catch it, they can start managing it. And if you need to see a specialist like me, they're the ones that can send you to me and send you a referral or give you a suggestion on who you should go see. So here's a simple rule. If any of this has been going on with you or for someone that you know, whether it's for weeks or months and it's not getting better, that's a sign. Come in. Guys, urologists don't bite. We're not going to judge you. I've heard it all. I've seen it all, and I've dealt with it all with patients and even some of these things myself in my personal experiences. Whatever you're worried about, I promise you, we saw something like that just this week. So if any of this sounds like you or sounds like someone in your life, your husband, your dad, your brother, your friend, share this video with them. It might be what finally gets them into the door. And listen, if you got something out of this, please hit that subscribe button. Hit the bell so you don't miss the next video, and drop a comment below telling me which one of these surprised you the most. I read all the comments, and I love hearing from you guys. And if there's a topic you want me to cover, something you've been wondering about or too embarrassed to ask, let me know down below. No judgment. That's what this channel's for. This is Dr. B. Take care of yourself, and I'll see you in the next video.